Hello friends, I am Dr. S.P Yadav from Medanta Hospital. I look after children suffering from blood and cancer disorders and perform bone marrow transplants at Medanta. Today I am going to talk about thalassemia. It is a disorder of hemoglobin, that patients have less hemoglobin and they need lifelong blood transfusions. So that is what thalassemia major is. So in this, hemoglobin has two parts: heme, which is made from iron, and globin, which is a protein which has two chains, alpha chains and beta chains. So we need alpha genes which make alpha protein, and we need beta genes which make beta proteins. So everyone has two copies of beta genes, one from mother, one from father. So if one beta gene is defective, then you are a thalassemia carrier. That means you are carrying a defective gene, but you are asymptomatic, you are very well, but you can pass on this defective gene to your child. When you inherit both defective genes, beta genes, one from mother, one from father, then you have no functional beta gene and you cannot make beta chains and you cannot make hemoglobin. And then you are a thalassemia major, you need lifelong blood transfusions. Thalassemia intermedia is a condition where you don't need blood transfusions every month. You make some hemoglobin, so you need blood transfusions less often, like every 2 to 3 months, 4 months, or once in 6 months. So those patients also are there. So the burden of thalassemia in India is about 10,000 children are born every year, so annually. So we have lakhs and lakhs of thalassemia major patients in India. And nearly 3 to 5% of Indian population is carrying the thalassemia gene, so they are thalassemia carriers. It is very prevalent in certain communities like Punjabis, Sindhis, Khatris, Agarwals, Bengalis, Assamese, and even some pockets of Karnataka and Gujarat and central parts of India, thalassemia is present. So depending on which area of India you live in, thalassemia carriers are more frequent in those areas. And if two thalassemia carriers marry, they are likely to have a child which can have thalassemia major. So anybody who is getting married or anybody who is expecting a child, they should go to the doctor and get tested for thalassemia, and their partner or husband should also get tested for thalassemia. If both of them are thalassemia carriers, then the baby can be tested for thalassemia in utero in 3rd month of pregnancy, and they can know whether the child has the disease or not.